One of the major blocks in successful treatment of chronic illness is denial of the illness. This is when the individual experiences difficulties in acknowledging and accepting that they have a chronic disease, and they either deny or minimize the impact of the disease on their lives. Now, in most circumstances, receiving the diagnosis of an illness can feel devastating. It's not uncommon to react to bad news by denying it at first. This denial can actually be helpful at the beginning. It can help the individual and the family with the time that they need to adjust to the painful realization that their lives may never be the same. But when denial persists, then it keeps people from receiving the help that they need and in learning effective ways to manage their condition. Illness denial can also affect family members in a negative way. For example, hiding one's diagnosis from family members can lead to isolation and lack of support, both for the ill person and for the members of the family. It can lead to dangerous situations such as compromised childcare, or agreeing to eat certain types of food, or participating in certain activities without minding the needs of the body. Illness denial is often associated with distorted and inaccurate understandings of the disease. For example, someone with diabetes might believe that diabetic people never have any fun, or all diabetic people will eventually need amputations, whereas both of these claims are inaccurate. Sometimes the spouse of the ill person might not accept the other person's medical condition and expect that life somehow will stay the same. In this instance, the ill spouse might attempt to honor the other spouse's distorted view and try to live up to that standard for a while, but sooner or later they realize that maintaining a lifestyle that does not accommodate to their illness is impossible, and this might lead to conflict and separation. So in conclusion, a sufficient degree of illness acceptance is necessary and crucial for effective treatment of chronic illnesses.